Types of autism spectrum disorders. There are three types of autism spectrum disorder. Autistic disorder. This is sometimes called classic autism. It is what most people think of when hearing the word autism. People with autistic disorder usually have significant language delays, social and communication challenges, and unusual behaviors and interests. Many people with autistic disorder also have intellectual disability, behavioral disturbances, deficits in language comprehension, delay in learning to speak, flat or monotonous speech, inappropriate social interaction. Asperger's Syndrome. Asperger's is a neurodevelopmental disorder characterized by significant difficulties in social interaction and non-verbal communication, along with restricted and repetitive patterns of behavior and interest. People with Asperger's syndrome usually have milder symptoms of autistic disorder. They might have social challenges and unusual behaviors and interests. Although no specific genetic factor has yet been identified, multiple factors are believed to play a role in the expression of autism. A comprehensive assessment involves a multidisciplinary team that observes across multiple settings and includes a neurological and genetic assessment as well as tests for cognition, psychomotor function, verbal and non-verbal strengths and weaknesses, style of learning, and skills for independent living. The gold standard in diagnosing ASDs combines clinical judgment with the autistic diagnostic interview, a conversation and play-based interview with the child. Delayed or mistaken diagnosis can be traumatic for individuals and families. For example, misdiagnosis can lead to medications that worsen behavior. Pervasive development disorder, not otherwise specified. The diagnostic category, Pervasive Developmental Disorder (PDD), is a group of disorders characterized by delays in the developmental of multiple basic functions including socialization and communication. Childhood disintegrative disorder, overactive disorder associated with mental retardation and stereotype movements, and Rett syndrome. People who meet some of the criteria for autistic disorder or Asperger's syndrome, but not all, may be diagnosed with atypical autism. These people usually have fewer and milder symptoms than those with the autistic disorder. Diagnosis is usually made during early childhood. With the release of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition DSM-5, the diagnosis for PDD was removed and replaced with the Autism Spectrum Disorder. Distinction between the past disorders is implicated by a series of severity levels. Individuals who receive diagnosis based on the DSM-4 maintain their diagnosis under the Autism Spectrum Disorders. However, an editorial published in the October 2012 issue of American Journal of Psychiatry notes that while some doctors argue that there is insufficient evidence to support the diagnostic distinction between ASD and PDD, multiple literature reviews found that studies showing significant differences between the two disorders significantly outnumbered those that found no difference. Hans Asperger described the common traits among his patients, family members, especially fathers, and research supports this observation and suggests a genetic contribution to Asperger's syndrome.